Let me know. Yeah. All right, guys, it's our weekly drop. Today we're going to talk about how do you grow your team. One of the questions that I get asked most frequently, all right? And primarily I get asked this question is because the DON is doing everything. And I need you DONs to please change your mindset. All right, just because you are the DON of the facility does not mean you are there to do everything. You are the director of nursing, okay? You are to direct the nursing department, all right? You're responsible, but how successful you are, I can't express this enough, determine on the type of team you build, okay? So how do you grow your team, all right? First, I want you to start looking at the people that you have in appointed positions, all right? So you're the DON, all right? You may or may not have an ADON, okay? You may or may not have this position. All right, typically if you don't have an ADON, you will have unit managers. All right, then you have your supervisors. You have charge nurses, which would be like, your LPNs. You have your CNAs, all right? CNAs are the what? Brick of the building, all right? So you might have these positions. You may or may not, all right? Then you also have your infection prevention nurse. And I left these two to the side for a reason. All right, you have perhaps a wound nurse, and you have an educator. All right, so this may be or may not be what your facility looks like in terms of hierarchy when it comes to your facility. Now, if you're a smaller facility, you might not have all these positions. If you're a facility that's staff challenged right now, you again might not have all these positions. So the goal that I try to teach DONs is try to educate your team as much as possible to function ahead, all right? Now, of course, your CNAs can't function as a charge nurse, right? But you want to start growing your charge nurses, all right? So, for example, you have charge nurses that are full-time on your unit, right? And you might find one of your charge nurses are very organized, right? They keep up with everything. They know how to interact with the doctors. They know how to interact with families. So you can start teaching her how to either function in a supervisor role, or you can even have her start functioning as a unit manager, all right? Meaning if any one of these positions are out, someone from this position can step up. All right, and then it's not always falling on the DON to then cover. All right, so start growing from this position. All right, and I'll take this opportunity to just meet with them to say, hey, what are your goals are? All right, a lot of times we don't even know what our goals are for our team. So how are you going to grow your team if you don't even know what their career goals are? All right, if they plan on being with your facility, or if they're invested in your facility, all right? So grow this person here, all right? Remember, your charge nurse is responsible for that wing, all right? It's not just medications, all right? It's not just medications. They're responsible for your CNAs, all right, making those daily assignments. Okay, they should be checking that POC documentation to making sure that all the documentation for the CNAs are done. They should be checking to make sure that the showers, all right, a big complaint for our residents is that they're not getting their showers. So they should be checking to make sure the residents' showers are done. All right, your supervisor, all right, yeah, say your supervisor is typically the DON in a facility in the absence of the DON. Right? When the DON is off, it's not like there's somebody else in the building. No, that supervisor is then responsible for the overall care in that building at that time. All right. So this supervisor needs to know as much information as possible. And I say this because supervisors on off shifts have the least support. All right. They have the least support. So, but they have a heavy workload. They might have admissions, they might have discharges, they have hospital transfers, they have incidents and accidents, they're dealing with the schedule, they're dealing with monitoring breaks, they're dealing with family concerns, they're dealing with the physicians. So they have a lot on their plate and it's only them. All right, so remember in your daytime hours, right? Your daytime hours, you have your DON, your ADON, your unit manager. All right, and then you have perhaps these people over here. All right, so you may have 4 to 5 people during the daytime. And then in the evening, that all fluctuates from 4 to 5 appointed people to 1. So imagine all of that workload then going on one person. It's a lot. So the more that you can educate them on how to manage the shifts when they're on, giving them a guide, a checklist, anything that you want them to do, the better off you're going to be when you come back to work the next day. The better off your unit managers are going to have to be in regards to follow-up, all right? Anything that happened on the previous shift as well, okay? So again, find out the goals for these people. Your unit managers, all right? Typically unit managers want to go here or they want to go here. All right, I have seen some go here to the education route, and this is also great if they have that that ability to teach. All right, but find out what this unit manager goal is. All right, in the event of emergency, all right, you have to take a FMLA for a month. Who's going to step in your spot? All right, so let's take it back to they need to know as much as you do. All right, they're not going to know 100%, but give them the tools so that they can function in your absence. All right, so we have the DO1 planner, we have the unit manager planner, both geared specifically to help that person thrive in that position. All right, and I also give unit managers DO1 planners, okay, especially if they want to be a DON, they need to see what that looks like. All right, so the goal of when you're getting the DON planner is that you're getting this person the unit manager planner. All right, and this is going to help this person thrive in that position. And then everything, again, isn't falling back on the DON when this person is absent. All right. And then if you have the ADON position, I'm not going to lie. Sometimes that's sometimes can be the most challenging position to fill. And people ask me all the time, oh, what does the ADON do? And it's hard to tell depending on the setup of your building, all right? So sometimes you have an ADON, they might be an educator, they might do infection prevention and control, they might round on wounds, all right? It's not really sometimes specific. So I always tell people, if you're going into an ADON position, be sure you know what your job description is, you know the role that you're playing, and you know the task that you're going to be responsible for. Because a lot of times the ADON can get tied up in so much floor work that they don't even get to see or meet the opportunities of their own role as the ADON to even learn to see what a DON actually does, because they're pulled in so many directions. All right. So this is definitely, and this is why I don't have a planner for the ADON, which is why I only have a unit manager, because typically if you don't have an ADON, then you have unit managers. All right. So, but this role is so diverse. Like, I mean, it goes in so many different areas that it's really hard to put out a planner specifically for it, because you can be doing so many different other things. All right. Now, this is how you're going to be growing your team. Everybody functions up ahead. All right. And then even with your CNA, let them get a CNA that's going to be an actual a mentor. All right. That takes care of a lot of the things for the new CNAs. All right. Appoint someone strong in that position. Now, if you have an educator, this is crucial. This position is crucial. All right. In order for the DON to get to where she needs to be, all of these people have to be educated. All right. Now, if this educator doesn't even know what the DON responsibility is, if this educator doesn't even know what the role of the unit manager is, supervisor, charge nurse, then it's going to be the DON responsibility to teach them that role. All right? But get people that are appropriate for the position. All right? A lot of times we are putting bodies in positions that don't belong there. And I get it. It's like we want to make sure that a person is just in that position. But if they're not knowing what they need to do, it's only going to put more work on you as a DON. All right, so get people in appointed positions. All right, and if they don't know what they do, know what to do in that position, then make sure you as a DON get them the type of resources that they need in order to function in that role. But don't just hire someone just because they say, oh, I want to be the educator, or I want to be the unit manager, and they have no clue of what it is in that position. Unless you're going to invest in them and educate them and train them appropriately to then educate these people to then support you, the director of nursing. All right. And that's the same for your infection prevention. All right. Don't just put people in these positions that don't have the experience. If you put them in the position, then you have to take the responsibility to educate them. You have to take the responsibility to, train them to meet the needs of the facility. And this is essentially what growing your team looks like. All right. Remember, as a DON, you are only as strong as a team you have around you. All right. So it's a lot of positions that are around you. And then it's even more challenging when you are missing pieces of the puzzle. Okay. So if you're missing somebody over here, that means your workload is harder. If you're missing somebody over here, that means your workload is harder. Unless you train these people, you hire them, you invest in them, you give them a good orientation. I know I talked about it a few videos ago. We're not taking the time to properly onboard, educate, and train our staff. Okay, yes, I know it's costly, but negative outcomes are even more costly. All right, so that's my spill for this week. How to grow your team. All right, as always, if you have questions, you can email me, consultant@welcometolongtermcare.com. Like, comment, and subscribe to my YouTube channel, and I will check you out next week. Have a great day.